Did you know that pancreatic cancer actually kills more seniors every single year than colon cancer? It's true. Yet, tragically, most people over 60 have never, not even once, been warned about its early signs. And the thing is, these signs, they show up months before the disease becomes untreatable. So today, in this explainer, we're going to unpack exactly what those signs are so you can finally stop dismissing them as just getting older.
11%. Yeah, 11%. That is the chilling survival rate for pancreatic cancer. But hey, I want you to listen closely to me here. This is not a death sentence. Actually, it's a timing issue. We need to completely reframe how we understand this disease.
I want you to really think about this quote. It doesn't have an 11% survival rate because it cannot be treated. It has an 11% survival rate because it gets caught too late. Think about that. These early symptoms are literally happening right now inside people sitting in their living rooms, people who just think they need a bit more sleep, or that their aching back is just acting up again. So that brings us to a pretty provocative question, right? Why does this cancer win so consistently? I mean, how does it just go completely unnoticed for months, quietly advancing while we go about our daily lives? Well, the answer comes down to basic human biology. Your pancreas, you literally cannot feel it from the outside. Your doctor can't examine it in a routine physical checkup, and your annual blood work will completely miss this cancer until it's already spread. It's like it hides inside the very symptoms you've been calling aging for years. In fact, there's a 75% chance you've already noticed at least one of the warning signs we're about to cover today and just completely dismissed it. All right, let's get into Section 1, Digestive System Red Flags. We're going to unmask the core symptoms. Okay, so there is this incredibly dangerous myth out there surrounding dark urine. Most seniors see it, they simply drink a couple extra glasses of water, the urine lightens up, and they assume, oh, I was just dehydrated, and they move on. But here is the dangerous reality. If you have a pancreatic blockage, that dark urine is going to cycle back. You drink water, it lightens up, but then the next day, it's dark again. Why? Because water fixes dehydration, but water absolutely does not fix a tumor. Let's look at exactly what's happening under the hood here. Your pancreas sits right next to your bile duct, which carries bilirubin. That's a yellowish waste pigment from your liver. So when a tumor grows on the head of the pancreas, it compresses and completely blocks this duct. Bilirubin can't flow normally, right? So it backs up and floods into your bloodstream. Your kidneys then desperately try to flush it out, and that results in urine that turns the color of strong tea or cola. If your urine cycles between dark and normal for more than 2 weeks, listen to me, that is not a hydration problem. Next up, we have what we call the pancreatic pain signature. This one is absolutely crucial because doctors misdiagnose this as arthritis or a pulled muscle all the time. Pancreatic pain starts as this dull ache in the upper abdomen, not your lower belly, and it radiates to your mid-back like a tightening band. Why does it do that? Well, because the pancreas is surrounded by a super dense network of nerves. When a tumor presses into them, that pain just radiates. And notice the specific red flags here. It gets worse 30 to 60 minutes after eating. It gets way worse when lying flat, which is exactly why you'll see a lot of patients ending up sleeping in a recliner, and it completely ignores ibuprofen or a heating pad. If it's a tumor, you're treating the symptom, not the root cause. We really have to stop assuming these things are just normal getting older stuff. Take a changing appetite, for example. You sit down, you take 3 bites of dinner, and you just feel entirely full. Naturally, you tell yourself your appetite just isn't what it used to be. But in reality, a tumor could literally be expanding beyond the pancreas and pushing against your stomach from the outside. It is physically compressing your stomach's capacity. Unintentional weight loss of more than 5% of your body weight over just a few months? That's not a blessing. It is a massive red flag. Okay, moving on to Section 2, systemic false alarms. This is exactly where cancer starts mimicking everyday life. This brings us to a super dangerous area for seniors, misdiagnosis. We're talking about jaundice, the yellowing of the skin or the whites of the eyes. That happens when bilirubin deposits into your tissues. But notice another massive warning sign here. Intense, relentless itching all over your body with absolutely no rash whatsoever. The bilirubin is directly irritating your nerve endings. The danger here is that pancreatic jaundice looks exactly like jaundice caused by common gallstones. So a doctor sees it, suspects gallstones, and those deeper, life-saving investigations get delayed for months. Now please pay very close attention to this next symptom, because honestly, this one has a body count before cancer is ever even suspected.
Pancreatic cancer releases proteins that make your blood abnormally eager to clot, often in your deep leg veins. If a piece of that clot breaks away and travels up to your lungs, it causes a pulmonary embolism. So if you experience sudden shortness of breath, sharp chest pain when breathing in, and a spiked heart rate, you need to call 911 immediately. Research shows that an unexplained blood clot can actually be the very first sign of pancreatic cancer, appearing up to 6 months before the cancer is even found. So this whole systemic hijacking, it builds into chronic bodily responses. Think about the difference between a simple passing bug and cancer inflammation. A bug resolves, but if you have recurring low-grade fevers that cycle in and out every few days, paired with waking up completely damp from night sweats, that is your immune system fighting a disease that isn't going anywhere. Your pancreas is inflamed, bile is backing up, and your entire body is just in this constant state of simultaneous alert. And all that constant internal battling, it completely drains you, leading to cancer fatigue. Normal tiredness is fixed by a good night's sleep, for sure, but cancer fatigue is completely unresponsive to rest. Pancreatic cancer cells are biologically programmed to intercept the glucose and nutrients your healthy cells desperately need. Basically, your body is being robbed of fuel every single hour. This is exactly why simple tasks, like walking to the mailbox or climbing just one flight of stairs, suddenly feel impossibly heavy. All right, Section 3, the final warning sign. This is the unignorable signal. When a tumor actually blocks that pancreatic duct, the enzymes that are specifically designed to break down fat just can't get to your intestines. So the fat you eat passes through your system completely undigested. This changes your bathroom habits in some highly recognizable ways. Your stool turns pale, almost gray or clay-colored. It becomes really greasy with this visible oily sheen. It floats because of all that high fat content, and it produces a smell that is distinctly more foul than normal. Look, let me be crystal clear here. This is a direct mechanical signal from your pancreas telling you a tumor is blocking its function. If this is accompanied by nausea right after you eat fatty foods, it is not just a stomach bug. It is a severe mechanical failure that's going to accelerate your weight loss and fatigue. If you have this symptom for more than 2 weeks, you absolutely need to demand a doctor's appointment within 24 hours. Which brings us to Section 4, your immediate action plan. Taking control today. Catching this at stage 1 versus stage 4 yields unrecognizably different outcomes. So let's look at exactly how you can take control today. Here is exactly what you need to do to advocate for yourself. Step 1, write down every single symptom you recognize, exactly when it started and how often it happens. Step 2, call your doctor. Step 3, read that exact list aloud to them. Do not summarize it. Do not just go in and say you feel off. Specific symptoms get specific investigations. Weight complaints just get sent home with nothing. And finally, step 4, if they dismiss your concerns, you have every right to push back and demand a CT scan or an ultrasound of your abdomen. At the end of the day, you are the only person in that room fighting for your life. So I'll leave you with this final thought and a question. Will you just call these symptoms aging, or will you take action today? You know way too much now to just ignore the signals. Please, do me a favor and share this explainer with someone you love, maybe someone whose back has been inexplicably bothering them, or someone who keeps insisting they're just fine. You might just be giving them the window they didn't even know they had. Keep learning, stay focused, and take control of your health.